COVID-19 is not the only public emergency that public health units in this province are contending with. The opioids crisis is wide and deep. With us on what that looks like in rural and northern Ontario, we welcome, in Timmins, Ontario, Michelle Boileau. She is a Timmins City Councillor and Chair of the Northern Ontario Service Deliverers Association. In Sudbury, Ontario, Crystal Kimawan, support worker at a 24-hour emergency warming centre at the Sudbury Action Centre for Youth. And in Barrie, Ontario, Dr. Lisa Simon, Associate Medical Officer of Health for the Simcoe Muskoka District Health Unit. And we're pleased to have all three of you on TVO tonight to help us with what is, unfortunately, still a terrible health crisis in the province of Ontario. Let's just put some graphics up to start with to set the table for the discussion to come and give people some of the background they need to understand this story better. Researchers recently released a comparison of the number of opioid-related deaths in Ontario prior to and then during the first 9 months of the pandemic. And here's what they found. From March to December 2019, 1,017 opioid-related deaths. Let's go a year later, March to December 2020, 1,808 opioid-related deaths, almost twice as many. A breakdown of the demographics is also particularly telling. There's been a twofold increase in deaths among men, a 79% increase in those between the ages of 25 to 44, and of particular concern, the pandemic has seen a 300% increase in opioid-related deaths in Northern Ontario compared to the southern parts of the province. And if we can do one more here, when you look at the population-adjusted opioid-related death rate by geographic location, for those listening on podcast, I'll just go into a bit of detail here because you can't see this. Suffice to say, the surge in Northern Ontario is clearly there. Look at that third set of bars. That red Northern Ontario bar during the pandemic period has really shot up. But it's also noteworthy that this is a rural problem as much as it is an urban problem. And when we look at location, urban, rural, northern, southern, everything's going up, but it is particularly an issue in Northern Ontario. So let's get into this. Dr. Lisa Simon, let me start with you. From a public health perspective, how does the opioid crisis and the deaths that it is causing compare to COVID-19 in parts of this province?
I think the bottom line is that they are comparable at this point, orders of magnitude in terms of what we're seeing of the impact of the opioid crisis and related deaths is dramatic and hugely concerning. I can speak to the numbers in my own region, which is Simcoe and Muskoka, during which, over the course of the period of time in the pandemic for which we have data on opioid-related overdose deaths would be from April 2020 to June 2021. We saw 195 people lose their life to opioid overdose during that time. The comparable COVID-related deaths in our region were about a quarter higher than that, around 246 deaths. So it's a similar number. And I think it's also important to note that people who are losing their lives to opioid overdose are much more often a younger age. 60% of the individuals here who lost their lives during that time were between 25 and 44 years old. So they're in the prime of their lives. Every life, no matter what the age, of course, is of great value, and we want to prevent those deaths, but it is noteworthy when looking at the impact. So lots of differences, of course, between COVID and opioids, that the situations can't be directly compared, but I do think we can say that the opioid situation, the scope of it is huge. The impact is dramatic. It was prior to the pandemic, and it is only worse now.
Let me do a quick follow-up with you on this because the numbers of deaths are comparable, as you say, but opposite, right? COVID is a disease that is fatal, particularly the older you are, whereas opioids appears to be a much more fatal phenomenon for those who are younger.
Correct.
99% of what we've been hearing for the last couple of years is COVID, and we hear precious little about opioids. Why do you think that is?
I think it's a good question. I think it's one that we need to keep asking. And I think part of it is that COVID is relatable for everybody, right? COVID has impacted every aspect of our lives. Everybody knows somebody who's had COVID, and everybody has felt the restrictions in place because of COVID. With opioids, sometimes people, or with overdose deaths, or with addictions in general, sometimes people feel that it's not something that directly impacts them, and so they may not be as concerned or as outraged about the deaths that are happening and about the need to do more about it. So I think the more we are aware of what's happening, how it's impacting those who are suffering, as well as the broader community, there might be more of a groundswell to increase the attention and the prioritization that this issue receives.
Let's go up to Timmins and find out what the situation is like there. Michelle, how would you describe the opioid epidemic in Timmins?
Well, I would definitely describe it as a crisis. It's interesting that you should ask the question to the doctor about how the numbers compare between COVID and the opioid crisis. And quite frankly, up in Timmins, there are more deaths due to overdose than there have been related to COVID. So it does show the magnitude of the issue that we're dealing with here. I would also say that arguably everyone in Timmins does know someone that's been impacted by the opioid crisis. And so I would say that that has driven us in the past few years to really take strides in terms of trying to address this issue locally. But it's a major issue that our municipality and the region is struggling to deal with.
And let me ask you this follow up because COVID is everywhere. You see it when people wear masks, you see it when you have to present proof of vaccination to go somewhere you want to go to. So it is omnipresent in that respect. The opioid crisis may be less so to many people, but I wonder in Timmins whether or not in people's daily lives, whether it's visible.
It is, and it's become much more so, especially with the onset of the pandemic, with everyone moving indoors and staying home. It really shed a lot of light on what was actually going on the streets here in Timmins. And so a lot of people think that this is a bigger city issue, and suddenly we were starting to see it on our main streets because with less traffic in the downtown core. Understandably, it was just a lot more visible. So it's something that we're seeing, especially because we are dealing with, housing shortages, increased homelessness rates. So it's definitely something that is now present on our streets. And interestingly enough, in the past few years, it's really become an issue that's migrated from what would be encampments in the bush outside of the city boundaries, and it's really migrated into the city, and so it's become something that's been a lot more talked about, which has been positive in a sense because it has allowed for us to really move things forward.
It has brought some attention to the issue that maybe it wouldn't otherwise have. Is that what you're saying?
Yes, exactly. However, I wouldn't say that it's just due to the fact that it's become a lot more visible. I think that it's really just mostly attributable to the increase in the volumes that we were seeing in the emergency departments. So volumes of overdose related medical emergencies and opioid related deaths.
Got it. Crystal, as I get you into this discussion, let's just get some background on you because you've got experience on this file in a way that others do not. First of all, you're in Sudbury right now, but you're originally from where?
I'm from Wakwamacong, unceded Indian territory on Manitoulin Island. So I am First Nation. I am Indigenous. I do
And
possess a lived experience. So
well,
that's
that's what
that
I
kind
wanted
of
to get
sets me up.
into because you've been trained as a social worker, but I gather you don't call yourself that. You call yourself a peer. Why is that?
I refer to myself as a helper. I don't like the term social worker. Um, I began this type of work as a peer, so supporting other women within the very circles that I sought help within. Naturally became an advocate and guided into the field of social work. Um, I found in order for my voice to be heard, I needed to have an education. I needed to be on par with colleagues and to be able to have a voice at tables that we're designing policies to meet our needs as as people struggling with addiction.
Totally understand that. Can you, and again, I don't want to invade your privacy too much here, but on the other hand, I think we need to understand why you know this subject so well. So, can you tell us about your connection to addiction and how it happened?
Everybody's story is different. Mine rooted in trauma, 60s scoop, all the traumas affecting Indigenous people as a whole. I also think it important to note that the Chiefs of Ontario actually came out with a study in partnership with the Ontario Drug Policy Research Network that came out with a number of 132% increase at the height of COVID for Indigenous death by opioid overdose, and 68% increase for the rest of the population. I think that important to note. I've been frontline since the start. So how the pandemic impacted service delivery. I was actually working for a social services organization down south. And we were just not prepared. We were not prepared for how services would be impacted. Where I directly saw it, and when we talk about the ages, 25 to 44, those are families, those are mothers, those are parents. I want to say within the first 2 months of pandemic, we lost 3 mothers to overdose. When you look at how services are directly correlated, or helping services directly correlated to a mother's recovery, access with her children, and then you take that away all of a sudden, that impacts a mother's recovery in a way. Without those supports, like I said, a lot of our services were not prepared. We were not prepared at how COVID would impact how we service our community members.
So the pandemic has made things infinitely worse for you.
I think there has to be a word far greater than that to describe this. But yeah, definitely.
Okay, let's get some more information on the table here. These are stats from that recent report by the Ontario Drug Policy Research Network, and we'll bring those up now. 1 in 2 victims of opioid-related deaths had an encounter with the healthcare system in the month prior to their deaths. 1 in 4 victims had an encounter with the healthcare system in the week prior to their death. 1 in 3 people who died during the pandemic had accessed opioid agonist treatment in the past 5 years, and 1 in 10 had done so in the past 30 days prior to their death. Now, Dr. Simon, we need a bunch of explainers here. First of all, opioid agonist treatment. What is that? Let's start there.
Sure. And I will just start by saying I'm a public health physician. I'm not a clinician. I don't see patients. I don't treat people for opioid use disorder, but I'm certainly happy to help with the basics of it where I can. So opioid agonist therapy are medications, first-line medications that are used to treat opioid use disorder or opioid addiction. The most common ones are Suboxone and methadone, but there are also other options.
And what do those statistics tell you?
Those statistics about healthcare system access, and I think that the report you referred to express those well, and we've seen similar statistics in our own region through data collaboration with Statistics Canada. We know that people who are dying of opioid overdose have often had interactions with the healthcare system and sometimes with social services, justice systems in the period of time prior to their death. And so what we are all working to do and need to increasingly do is use those opportunities to check in with individuals who may be at risk and see how we can optimize the health and social services that they're accessing. Do they have more needs from a treatment point of view, from a harm reduction point of view, from a housing point of view? But these are folks who are connected in one way or another, but clearly there are missed opportunities.
Can you help us understand this better, though? Because the assumption would be if you've had an interaction with the healthcare system, then theoretically you should be far less likely to be dying a week or a month later of your addiction. What's going on here?
So, a couple things. Firstly, most of these interactions are probably not related to the opioid use disorder that the individual may have, or they may not even have an opioid use disorder. We actually know that maybe two-thirds of people who are dying of opioid overdose from that recent report seem to have an opioid use disorder. The others are just perhaps using sporadically, but they may have interacted with the healthcare system for all sorts of other reasons, whether it be an injury or mental illness or physical illness or what have you. And so one may not have broached the issue of substance use at that time. The other option is that they were being seen for something related to their opioid use disorder if they have one, but they may not have been connected with all resources that would have been helpful to them. So, for example, maybe they went into the emergency department for an opioid overdose. They were treated appropriately and they were discharged. Did they receive at that time, though, as a basic take-home naloxone to help with reversal of future overdoses? And also importantly, did they have opportunity there to be offered the initiation of opioid use disorder treatments such as Suboxone or connections with treatment programs for counseling or opioid agonist therapy in follow-up if they wanted it. So there's all sorts of opportunities that these interactions present, even if the reason that brought one in is or is not related to opioid use.
Okay, let's get the view from Timmins because, Michelle, I know that you work with some of the people who are providing healthcare services. What are they telling you about the crisis from where they stand?
Well, I think it definitely has a lot to do with the fact that there's a lack of access to healthcare services in the region, and notably a lack of access to mental health care services. And so, as the doctor was mentioning, I think it definitely has a lot to do, and that's what we're seeing here in Timmins is that people were presenting themselves to the emergency department and were being released after just a basic treatment, essentially just treating them for their anxiety and sending them back out after they've they've hit a certain level of recovery, but they weren't being connected with those community resources, and that's what really drove two of our emergency room doctors to take action. And so they were able to initiate the implementation of two acute withdrawal management beds at our hospital. And so instead of releasing people back onto the streets, they were giving them the opportunity to actually go and deal with their withdrawal symptoms in a medical setting. We're also starting to see the introduction of the connection to programs such as the Suboxone programs and such. And that's something that wasn't happening until the very end of 2021 here in Timmins. And so I think that the increase in the stats and the death rates is definitely due to the fact that people weren't being treated for their acute opioid addictions when they were presenting themselves to medical services. And I would also say that once a person starts on their path of recovery, their tolerance level will definitely change. And so if they're not connected with the right supports, then if there's a chance of relapse, the chances that relapse results in death are much higher than they might have been before. And so that's why it's really important to always be following up with these people as they continue on their path to recovery and making sure that they're being connected with the right resources. But when we deal with the lack of medical resources here in the region, and we have a shortage of physicians, a shortage of mental health clinicians, and we're now even just starting to see a shortage of your basic social services. It means that people are being left to their own devices, trying to see out their recovery, and unfortunately, if they slip, the right services aren't there to help pick them up.
Well, let me pick up on that because I want to better understand whether the key problem here is an inadequate amount of services in the hospital setting or in the community setting. Which is the bigger issue?
It's such a complex issue, and I would say that it's across the board. But what we were seeing in Timmins was that there was definitely an issue with in the hospital setting, even just in terms of the medical staff's attitude towards the issue. And as we were saying, now that we're talking about it a lot more, the way we've talked about this issue has changed here locally in the community. There's been a lot of education and a lot of awareness that's been done, and at the medical professional level. And so now the hospital has really joined forces as a team to help treat people that are dealing with acute addiction.
Okay. Krista, let me get you back in here because, again, from your firsthand and frontline experience, I wonder if you can convey to our viewers and listeners what this issue does to people, does to their families, does to their friends. Give us some sense of that.
Okay. I work frontline in, I want to say, a last resort for our homeless, our substance using community members. When we talk about issues, yeah, they're across the board within hospitals. Funding from city is limited. Service provision is limited. Frontline workers are burning out. And that's the reality of it. Within the organization that I work within, it is hard just to even keep our floor staffed. I want to say this is directly correlated to the lack of services that are within community, support circles, recovery support circles, organizations that would have been open during the day to have coffee and go and have tea and connect with other community members. We're also seeing that Sudbury has the highest rate of opioid overdose in Ontario. And this is huge. What we're facing on the front line is, honestly, I don't even know how we're getting through it. I really don't. I think it is an amazing team of frontline workers. Primarily, a majority of us are peers. We're peers who have gone to school, gone to college, gone to university to be able to give back to a time and space that we have a connection to. Our city can help with housing. We've lost, I want to say, 2 people that I know of that have recently been housed from being homeless have overdosed in their home, in their newly acquired home, because this is a community, this is a sense of, and then you displace this individual and place them in without those supports. And this was mentioned across the panelists here, without those supports following this individual to their new home. You're disconnecting them from community and the grief. Every week we're losing somebody. Every few days we're losing somebody. And that grief that is felt on a community level by this is family. This is family within these organizations that we work within. And we're burnt out. We don't have service providers for us as frontline workers to be able to do the work we need to do to be able to return to work the next day. And I cannot stress this enough. COVID has greatly impacted. COVID has greatly impacted and increased the rise. I see it. I feel it. I live through it every single day. I lost my partner a year ago.
I'm sorry.
6 months or a year prior to that, not even a year, we lost his sister to overdose. 4 months prior to that, he lost his niece to overdose. So this is something, this is what we're functioning in as frontline workers. And I think that just the fear of being COVID and the spread of COVID is really restricting a lot of workers from doing what they would have done prior to COVID, I guess. The connection and just something as simple as hugging a community member goes a long way after they've lost a friend or family member.
I'm so sorry for your loss, and I want to take that tragedy and put it into a question for Dr. Simon, and that is, you've shared the numbers with us. So maybe we should finish off on this. You've shared the numbers with us that opioids and COVID are comparable crises in many parts of this province. We well understand what resources have been brought to bear to fight COVID. Is it time to declare a public health emergency as it relates to opioid addiction?
First, I do want to express my sadness at Crystal's losses that you've described and the trauma that you and so many others are facing on the front line. Very understood and appreciated for all the critical work that you and others are doing. In terms of the issue of an emergency and if the opioid epidemic should be declared an emergency. So, in my mind, there is no doubt that the magnitude of the crisis is an emergency. In notion, it is an emergency, and it needs to be prioritized in an urgent and very strong way to get in place the resources, the policy change, and the coordination that we need to address this issue better across Ontario and across Canada. If declaring an emergency would help achieve that, then that is something that absolutely the provincial and or federal governments should examine. I say that because the declaration of an emergency is a formal regulatory action, and so that needs to be considered. I think prior to COVID, typically we thought of emergencies being declared in very short-term ways with fairly clear short-term fixes, of which, of course, the opioid crisis doesn't fit. It's a chronic, extremely complicated issue. But COVID has changed the perspective on that a bit, and you can see the way that we've used emergency legislation to help us manage the COVID pandemic, and I think that gives some insights as to what may or may not be helpful in managing the opioid crisis. So I think the question does need to be addressed by the provincial and federal governments. But regardless of whether or not we formally declare an emergency, what we do need to do is up the prioritization on this issue in terms of the extent of commitment, resourcing, conversation, and policy action that we see to address it.
And that message has come through loud and clear from Dr. Lisa Simon, Michelle Boileau in Timmins, Crystal Kimawan in Sudbury. I want to thank all three of you for coming on to TVO tonight and having a very hard conversation about a hugely important topic. Thank you so much, you three.
Thank you.
Thank you, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.